Actually, these patients have now, since the last 2-3 years, a new treatment option that is the targeted therapy. I think that Encorafenib plus Cetuximab is now the standard of care as a second line of therapy. Based on the results of the BEACON trial, we do not want to risk not to offer to our patients this treatment option, and so we have not to wait the deterioration of ECOG performance status, and we cannot postpone the use of this treatment option that is the best arrow in our quiver for the treatment of these patients. So Encorafenib plus Cetuximab is now the standard of care in BRAF mutant patients, both in a pMMR and in dMMR. Future research efforts aim at combining the targeted therapy with immunotherapy in both subgroups. In dMMR in first line, in the SEAMARK trial, pembrolizumab plus Encorafenib plus Cetuximab is evaluated, and in pMMR mainly in the advanced line of therapy, where a randomized trial with Nivolumab is currently ongoing.